Staring down a long nurses' strike is daunting for everybody, for the nurses, for us, the potential patients, and for the hospitals who need nurses to be able to do the work to keep people healthy. When the first strike happened in the fall, it just was 3 days, and the hospitals and nurses got through it. But this time we're talking 20 days down here and indefinitely up north. The time is now to make a deal as the clock is ticking to strike day next weekend. So who holds the winning hand at this point? I asked a labor expert that very question.
It has a lot to do, I think, with public perceptions and who's winning the battle for the hearts and minds of Minnesotans. If the nurses are seen as really fighting for patients over profit and fighting for a just cause, I think that they hold the upper hand in this.
Of course, there aren't just two sides to this issue. Patients are impacted by both a potential strike and the working conditions that have led to it. With everything that's at stake, some of you have asked whether our government or our governor could take steps to get involved. Kent took a look at that today and joins us now with what he found. Hey, Kent.
Hey, Jana. Yeah, even though a long strike could have a big impact on our healthcare system, labor experts say it wouldn't constitute the kind of emergency that would open the door for government intervention per se, but they say the governor could still play a critical role. In the midst of the last three-day nursing strike in September,
hey everybody,
Minnesota Governor Tim Walz showed up at a picket line to voice his support for union members.
we stand with you in solidarity. Thanks again, everybody.
This morning, he took a more measured approach. In his first public appearance since nurses voted to authorize a longer strike at a time when hospitals are struggling to keep pace with respiratory illnesses, the governor acknowledged the higher stakes and his hope to help avoid a walkout.
My first and foremost concern is the safety and the ability, as it was through COVID, for a Minnesotan, if they need care and they need a hospital bed, that there's one available and they get it with the staff to be there, but also to make sure that we're protecting those the needs of the staff that are there. We already know this is a very difficult profession. We don't want to lose people in that, and so this negotiation is critically important.
We're in a more serious situation now.
But Mitchell Hamlin law professor David Larson says the governor has limited options to help broker a deal, unlike the ongoing dispute with federal rail workers, which allows the president and Congress to intervene.
The governor can try to intervene, but doesn't have the same kind of power to enjoin anything that's going to happen. That doesn't mean you can't have some influence.
That is what happened in 2016 when a line of nurses went on a second strike. Then Governor Mark Dayton brought the two sides together for mediation that did produce a compromise.
We definitely are there, that we need intervention, and it looks like Governor Walz is willing to do that. Does not have a lot of time to operate. A little over a week.
And Professor Larson says there are signs of hope, the biggest being that nurses and hospitals acknowledge that they're now about 6 percentage points apart on pay.
So now they're really within range of reaching an agreement. So that's promising. But the thing that, again, is going to be problematic is this staffing question.
And because neither side can just fix the shortage of nurses, he says it might take the governor to help them find common ground before it's too late.
We're engaged and have been with both of these entities. So we're hopeful. We're still at a process. The collective bargaining process is still working. This is an order of intent to strike. It is not a strike. So there's time here and there's work to be done.
Now, to that last point, even though nurses have agreed to begin their strike on December 11th, Professor Larson says the union has the ability to push that back and give more time if they feel like they're making progress towards a deal. And both sides say they will keep negotiating. In fact, we've mentioned it before, but Allina and its nurses have a meeting scheduled for tomorrow. Jana.
And Kent, do they schedule these meetings one organization at a time, one hospital system with the nurses? Do we know about a schedule or just that one?
That's the one we know about right now. There are a lot of different meetings happening throughout. It just depends on, and there's a lot to keep track of here. Certainly, we'll be getting updates as it comes down.
All right, thanks so much, Kent.